Like any other thing that we do in our day, there are risks and benefits to life. Getting out of bed in the morning is more risky than staying in bed, but we think that the benefits of getting out of bed and going to work or going to the grocery store outweigh the risks, so we choose to do that. There's no difference in that in how one should look at vaginal birth after cesarean. Somebody might define a risk of 1 in 2 or 300 of having a ruptured uterus to be unacceptable. Other people might say that that's a small risk, and if it's something that usually has some forecast, and it's not something that happens immediately, then I'm willing to take that risk. The risk of having repeat cesarean sections over and over again are significant, especially if a family wants to have 4, 5, 6 children. Having 4, 5, 6 cesarean sections can lead to thinning of the uterus, possible uterine rupture prior to labor in other pregnancies, can lead to scarring, pain, potential risk of increased blood loss, damage to the bladder, bowel obstruction, placenta growing into the uterine wall, causing the need for possible hysterectomy at the time of the subsequent C-section. These risks are usually not mentioned to women. All they hear is you could rupture your uterus and your baby could die. In 2004, the American College of Obstetrics and Gynecology changed their recommendation for VBAC, which they had always been supportive of. And they changed the word readily available for emergency help to immediately available for emergency help. Immediately is no longer defined as 20 or 30 minutes. Immediately is defined as having in-house support for an emergency cesarean section, which meant that the anesthesiologist, the OR crew, the obstetrician's surgical assistant would have to be immediately available in order to do this. Well, most hospitals in the country can't afford to have that. They just don't have that. So what happened is the risk managers of these hospitals decided that we're going to, quote, ban vaginal birth after cesarean. We're not going to allow it at our hospital. And this has become pervasive throughout the country. More than 800 hospitals, I believe, at this time have, quote, banned VBAC. At the end of the day, if a woman walks into a doctor's office and all she hears is the skewed informed consent, if you have attempted VBAC, you're going to have a potential for rupturing uterus and killing your baby. She's going to choose to have a repeat cesarean section and not a VBAC, and that is really unfair to give that form of skewed informed consent. And ACOG does have a brochure out that still supports vaginal birth after cesarean. Their only thing about changing the wording was about caution about where it should be done. But it wasn't something that said VBAC is something that shouldn't be done. And ACOG has been very clear about that.